Healthcare is back at the center of the fight in D.C. with enhanced Obamacare subsidies set to expire at the end of the year, meaning millions can face higher premiums. The White House at this point is weighing a new health care plan that may extend some of those subsidies, a move that could split Republicans. But one group says lawmakers should go in a different direction. Joining me now is Grover Norquist, president of Americans for Tax Reform, one of the most influential voices of tax policy really in the country for years now. Thank you so much for joining us, Grover. But before we get to why you're here to talk about health sharing ministries, let's just begin with these Obamacare subsidies. If you were advising the president at this point, what would you tell him to do with these subsidies?
Hey, the reason why we need health care subsidies is because Obamacare failed. Obamacare did not do what President Obama said it would. You were supposed to be able to keep your doctor. That was not true. Everybody was supposed to see their insurance premiums go down by $2,500. Instead, they doubled. And because of the way Obamacare is set up, very few choices, no transparency, it's the post office trying to run a hospital very poorly, costs go up, and the subsidies are to hide the failure of Obamacare. Why in the world would Congress spend any time at all bailing out a failed system that doesn't improve? What we need to do is give people alternatives to leave Obamacare. Right now, there are laws telling you have to have Obamacare. The Republicans took the penalty for that to zero. There used to be a big thousands and thousands of dollar fine because they knew people wouldn't want it because it wasn't any good for most people. So they said, okay, you don't get the fine. But if you want to get a lot of places, you do get stuck with Obamacare. We need to give people an off-ramp health savings accounts, or probably 70 million people have health savings accounts.
Right.
Much more flexible than what Obamacare does.
Do you think that off-ramp should be maybe a slow one? Only because you know lawmakers are getting these calls. You have, 22 million people who are on these subsidies, and they're getting these calls from these folks saying, listen, if these subsidies go away, I won't be able to have health care insurance. So what do you do for those people now who are making those phone calls to their representatives who are concerned about this?
Two things. 22 million, if they're telling them that, they're lying to them. The people for whom the enhanced subsidies, which, by the way, the Democrats passed a law to extend these subsidies to cover up for Obamacare. It was to end in January. That was the Democrat plan. So when the Democrats now complain that the Republicans won't do something that they didn't want to do because it was too expensive and didn't make any sense, that's just politics. And in point of fact, what did the administration say? You have to be a citizen, not an illegal immigrant, to get these benefits, and you have to be looking for work, not even working, just looking for work. And there are a bunch of people who say, I don't want to look for work. I just want free health care subsidized by somebody. The answer to that is no. Get a job. Young men between 25 and 35, get a job. This is not about people who have kids at home or have handicaps or anything. These are people who could and should be working and choose not to because the way Obamacare was set up, you didn't have to work.
Well, let's talk about the health sharing ministries, which is really, and just make sure I have this right here. They're faith-based membership programs where people kind of pool their money to pay each other's medical bills. Now, you're saying that maybe the IRS should treat health sharing ministries the same as these health insurance for tax purposes. Why do you think that would benefit more Americans?
Well, right now, health sharing ministries, 1.7 million people do this. But it could be a lot more people having that opportunity if you could have tax deductible what you put in, the way companies do, the way corporations do it, to treat health sharing ministries the way we treat other insurance pools or insurance that people have. So they're not asking for some special benefit. They're not asking for a subsidy. They're simply asked to be treated the way other businesses are that provide health care. They do it through cost sharing among people in a particular religious faith. This could be 10 times as big if the government would step back, and some of it can be done by executive order or by a change through reconciliation. Some would require laws to change.
Now, you said, 1.7 million people already?
Mm-hmm. Yeah, that's a good way to check and say, how's it going? Yeah. Those are the people who would quit if they didn't like it, and who could explain to people, here's the way it works, here's how it's done. Health savings accounts is another off-ramp as well that has 70 million people doing it. But the Democrats put in laws to make it difficult for people to use health savings accounts. Not everyone who could use it is able to get to it. That needs to be changed so that everybody could, if you like Obamacare, you can keep your Obamacare.
Yeah.
We're not going to throw additional subsidies at the failures of Obamacare, but if you'd rather have a health savings account or sharing ministries, those should be options for everybody without government restrictions that the Democrats stuck in there to force you into Obamacare.
All right. Thank you so much, President of Americans for Tax Reform, Grover Norquist. Thank you for joining us. Happy Thanksgiving to you.
Good to be with you.